Well, hello and welcome to all of our viewers around the world. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. Welcome to everyone joining us. We're talking about our Gold Lactation Online Conference 2024. And I have Megan Dunn, who is here with me today. Welcome. It's so good to have you here, Megan.
Thank you, Fiona. I'm really glad to be here too.
Yes, and you are speaking at our up and coming conference, of course, live, which is truly, I think, one of the best parts. We can all agree that it's hard sometimes to make time to these live webinars, but truly, I think it pays off because we have such an incredible opportunity to sit with you, my friend. I have learned so much from you already about the topic that you're sharing. Let's tell the friends what they are going to be learning about. So, navigating PCOS during lactation, solution-focused strategies, and equity in care. So, Megan, tell me, this has obviously been a little bit of a journey for you. You've set this all up, we're ready to go. But tell me, what were some of the things that surprised you while you were setting this all up?
There are so many things about this topic that were surprising to me. All of the presentations are born out of curiosity, and I realized I didn't know enough about this condition in the context of lactation. So I have learned many things, including that there are multiple kinds of PCOS. Prior to beginning my research on this a few years ago, I think I was very familiar with the insulin resistance form, but I
Mm.
didn't know so much about the other types of PCOS and how that could impact lactation.
Yeah, I think that, as we sort of, the more we learn, the less we know. Isn't that something that they say? But truly, I think it's because some of the instances of research, some people were, still learning about themselves, even understanding how their bodies function. And then the reality is that, there really sometimes I feel like there hasn't been the demand where some people have, if in the fact that they've had an illness, a disease, or an impact, something that has impact lactation, and it becomes difficult or no one has the answers, they just don't breastfeed, Megan. I mean, how many times have you heard those stories, right? And that is just heartbreaking. But tell me, when you looked at the research, some of the things that surprised you, but what were some of the things that you thought, okay, thank goodness this connects the dot, because we have a lot of gaps in care. So tell me about some of those gaps that you're happy to see have sort of caught up a little bit in our profession.
I think that you are right. We have learned a lot over the last, I'm going to say, couple of decades, because I've been doing this for about 20 years. And parents really don't accept that some people just can't breastfeed line anymore. And so that has pushed us into learning a lot more. When I first started doing this work, I think a lot of times we had a presumption that certain people with certain medical conditions like PCOS or insulin resistance just weren't going to be successful. And I don't think that we can predict failure in advance. We're
Right.
learning a lot more about both the short-term effects of insulin resistance and how we can overcome those with really robust support plans and education for parents.
Oh, I just love that. Now, tell me a little bit about your background, because I think this is what gets us to where we are today. You have such a passion for, well, not only humanity, but really finding solutions for people, in this complex world of lactation. Where did you all begin, or where did you all come into this profession?
Yeah, I think I got here the same way that a lot of people did. I thought I was going to have a completely different career. I thought I was going to be a high school English teacher. Then I had a child, and everything changed. And I became, again, really curious
Mm.
about how I could help other people that had experienced similar problems as myself. So I spent about 9 years as a La Leche League leader. And from there, I started working in public health and eventually became a lactation consultant. And I've just been doing different types of support for infant feeding and lactation care this whole entire time. And it's a career that is definitely built out of passion. There's a lot of gaps when it comes to maternal health care and when it comes to women's health care in general.
Mm.
And I want to try to plug up some of those gaps and give people the care that they need.
Yeah, absolutely. And I think with this topic, this is a topic that seems to come up over and over. We talked before about the instances of, perhaps the disconnect between even understanding how, PCOS can in fact, impact breastfeeding. And I know we discussed offline, I was talking about a client that didn't tell me until she was couple of weeks into breastfeeding, and that we were trying to figure out what was going on. So, do you find that overall, you mentioned really about parents, putting the demand on the profession? Do you think that the profession is matching up with that demand yet? Have we caught up in the gap between, what folks want and the education that's out there? Or do you think that there's still a fairly, big gap there?
There's a huge gap. It's vast.
Mm,
I got to speak to my own gynecologist last week,
mhm.
and he asked me what I'd been up to, and I told him I was getting ready to do this presentation for you, and he goes, "Okay, give me your 10-second elevator speech. What
Right.
do I need to know as a
Oh,
gynecologist?" He's amazing. I love him. So I was able to share some information with him, and he had absolutely no idea. And the
right.
bottom line I shared with him is if you have a patient that has PCOS, please have them see a lactation consultant prenatally so that we
Mm,
can give them a customized care plan. And I think he really took that to heart. But because we segment our care in the
mm,
perinatal world from gynecology, midwifery, and then we go postpartum with a pretty big gap until you go
sure.
back to see your provider. And then we have our babies seeing oftentimes a different provider. Um, the whole picture is really held by lactation consultants. It's held by
Mm,
doulas. It's held by all of our postpartum support people that are able to see the dyad as a unit
mm.
and see how everybody is being affected. So we need better communication with our prenatal care providers about what they can do to help their patients and their clients really meet their feeding goals.
Oh, wow. I think you just hit the nail on the head there, honestly. I mean, that communication part, the how we're segmented really in our, as women and, families, they really don't have that continuity of care. We kind of think it's there, but it's really not. It's really piecemealed, to different providers. And then, we can talk about the lack of communication in terms of, who knows what, where, and when. But an excellent thought there. Talking to your gynecologist, you took a moment. It was a snapshot, but it could have changed the trajectory for that next parent that he sees or she sees. And so that is absolutely brilliant. We can do more of that. It doesn't need to just be held in a formal setting. I think there's much opportunity. I do see that you are working in advocacy. However, do you want to tell me, besides the elevator pitches that you get to capture, you work in advocacy as well. Tell me some of the good news in advocacy today and what we're seeing in terms of moving the profession forward and getting to those families when we need to.
Yeah, I see a lot more connection in my own community with medical providers, physicians, PAs, NPs, all really wanting to connect with lactation consultants. It's heartening to see that because
Mm,
it wasn't really that way when I first started doing this work. And the care coordination piece is a really big part of it. And as far as other types of advocacy, finding ways that, at least here in the US, we can connect our public health sector with
mm.
our health providers has been really important. And that's been a long term project that I'm working on so that more people can access lactation care. And that's how we get better outcomes.
Yeah, absolutely. I think that, takes us right back to really your work that you're doing here for us, at Gold Lactation, navigating PCOS during lactation, solution-focused strategies, and equity in care. I mean, that's the crux of, our focus here, but without all of those other pieces, it could be fruitless, in the sense of what we're doing. I'm so excited, honestly, that you're talking about this topic. It's sort of missed so often, and there are so many things we can do. We need to get connected with, of course, our clients. And I know you're going to showcase some of those things too as we get into the presentation. Megan Dunn, thank you so much again for being here at Gold.
I'm excited to be here. Thank you.
Well, and for all of you out there, don't forget you can come and join Megan on the live presentation. She'll be here. She'll be chatting with you. We have a live Q&A coming up as well. And for those who, of course, might not be able to come to this live event, you'll be able to listen to the recording at your convenience. But join us on the forums. They're up and live right now on the website. You can participate in engaging, sharing, your resources and such as well. We're excited just really to continue to move this profession forward. Thank you again to Megan Dunn for being here. And of course, to all of our viewers, thank you so much. You can check out the website right now at goldlactation.com. I'll look forward to seeing you again. Bye-bye for now, everyone.